and welcome to today's Brace Bites. Today's topic is a question that we very frequently get asked, which is when should my child start orthodontic treatment? And I suppose the answer to this question falls into sort of two different considerations. And firstly, there is the consideration of the clinical. So that is what your children's teeth look like at any particular time. So some children will have all their adult teeth through by the age of even 10. For some children, that doesn't happen until they're maybe even 14, 15, 16, even older. But generally speaking, we do like to see most of the adult teeth, if not all of the adult teeth, until we are suitable to start treatment. Except, and there's always an except, isn't there? When sometimes children present with little things that could be corrected before that. And so that might be something like what we call a crossbite, which is when instead of all of your top teeth biting over your bottom set of teeth, you maybe have one tooth that sits on the inside and it's trapped behind the bottom set of teeth, or teeth that sit really far forward, or teeth that are spaced out. So there are reasons to give children brace treatment earlier than when all of their adult teeth come through. And certainly in many countries, especially in Europe and in America and in Australia, children are often seen by the orthodontist by the age of about 8 or so that any of these early problems can be picked up and they can be dealt with as and when they happen, rather than waiting till later on. And very often in these countries, we perform what we call arch development, which means we try and create the space for the adult teeth to come through so that we are less likely to get crowding and we are therefore less likely to need to have teeth taken out. Now, the reason I say that this question falls into two considerations is that considering in this country, the clinical consideration is one thing, but the funding is another thing. And of course, in this country, because we have NHS funding for orthodontic treatment, many children aren't treated until a much later age, and that is simply to do with the way the funding structure works. So what that means is that on the NHS, you are only entitled to one course of treatment. So that means you can't deal with things as and when they're happening. You have to wait for the whole picture to present itself and then deal with it whatever it is. And that may mean that you've lost out on opportunities to self-correct things as they go along, but it's simply the way the system runs in this country. Now, that's not to say that you cannot seek an orthodontic opinion yourself. You can seek an orthodontic opinion privately. And indeed, many more of our patients are choosing to do that so that they can put their mind at rest. Of course, it is always a worry as a parent, isn't it? Because you don't know what's normal. You don't know what can be done. You don't know whether anything should be done at certain stages. And so we find that more and more parents are seeking an early opinion and paying for that private opinion just in order to put their minds at rest. They're not necessarily seeking to have the whole treatment done privately, but they just want to find out what their options are for their child and when things should be dealt with at the right time. And that is happening more and more so, of course, with the increase in the NHS waiting list, partly due to funding, partly because of COVID, but a culmination of that meaning that there are long waiting lists in many areas around the country, which makes a private consultation, if not private treatment, much more of an appealing option for a lot of parents. Now, certainly that's not necessarily an option for everybody. And if you were waiting for NHS treatment and NHS funding, that is something that is going to be possible for you to do, and your time will come certainly when you come to the top of the waiting list. But if you wanted to be seen sooner, and certainly we've had a patient in today, and this is a classic example where a 10-year-old child comes and they come with their parent and they're just interested to know what their options were. And when we have a look at everything, it basically transpires that they've got a missing adult tooth that we would not have necessarily known about for at least another 2 or 3 years. And we possibly might have even been waiting for that tooth to come through, even though it was never going to be there. And then that would have impeded and restricted the treatment at the end of the day. So your options are quite open to many different variations. And of course, your children can start treatment from as young as 8. Sometimes that's with a removable plate type brace, sometimes it's with a train trap brace. But I think the most important thing is being able to put your mind at rest and knowing that you're doing the right thing and you're able to do the right thing for your child. Have a lovely time. See you later. Bye-bye.